Hello, we will be taking two components of standard precautions today: hand hygiene and personal protective equipment. My name is Folashade Ogunshola. I'm a consultant clinical microbiologist at the College of Medicine, University of Lagos. Our learning objectives include to understand standard precautions, to understand and demonstrate proper hand hygiene during newborn care in the health facility, to understand and demonstrate the proper use of personal protective equipment. Standard precautions are work practices required to achieve a basic level of infection prevention and control. They are things that you must do at all times with all patients. It helps to protect healthcare workers, patients, and the public from acquiring healthcare-associated infections. And the use of standard precautions aims to minimize and, where possible, eliminate the risk of transmission of infection, which means that you must assume that all patients are infectious. The components include hand hygiene, use of personal protective equipment such as gloves, gowns, plastic aprons, masks, face shields, and eye protection, but these must be used according to a risk assessment to decide which ones you require. There must be a safe use and disposal of sharps, aseptic techniques for invasive procedures to prevent infections from going into sterile spaces, sterilization of reusable instruments and equipment, routine environmental cleaning, waste management, respiratory hygiene and cough etiquette, and appropriate handling of linen. Hand hygiene. This can be said to be the first step in IPC. The hands of healthcare workers are the most common means of transferring microorganisms, and this is because the hands are all over the place and they're touching surfaces. So it has been found that hands carry microorganisms and can move them from person to person or from person to the environment. So good hand hygiene can break the transmission of microorganisms in the healthcare setting, because we have found that good hand hygiene can reduce the rates of diarrhea, respiratory tract infections, and skin infections. So how are the hands contaminated? They're usually contaminated from infected patients, through contaminated environmental surfaces, from not cleaning properly, your suboptimal personal hygiene, such as going to the toilet and not cleaning your hands, touching surfaces and not cleaning your hands, or not cleaning your hands before you prepare food for babies, and through contact with body fluids. So how do you carry out hand hygiene? You can do it by two ways: hand washing and hand rubbing with alcohol. Hand washing can be two: to wash with soap and water, ordinary soap and water, or to wash with bactericidal soap. Washing with soap and water must always occur when the hands are visibly soiled and after using the toilet. And this is because the hands could have spores, and these are not often covered by alcohol. And also, when you have visible soil on your hands, the alcohol may not reach them because of the soil protecting the organisms. Hand rubbing with alcohol-based with alcohol is preferred for hand hygiene in healthcare settings when there's no visible soiling, because alcohol actually kills the organisms, while soap just removes the organisms by mechanical action. They are also more effective against most bacteria and viruses than either medicated soap or non-medicated soap. Alcohol-based hand are less drying on the hands because many of them contain glycerol, and while soap and water, if you use them consistently, become very irritating because the hands dry. So when should you wash your hand or do a hand hygiene or by alcohol hand rub? We have identified 5 moments when patients are at great risk, or healthcare workers are at risk, or these 5 moments when the risk of transmission is higher. That's one: before touching a newborn, because at that time you can be bringing microorganisms to the newborn. Before performing an aseptic procedure, Procedures that you require to do asepsis usually mean procedures that will be going into a sterile space, and so you need to ensure that the hands are clean. Or to protect yourself after exposure to body fluids. For example, if you've touched a urine bag or you change the baby's diaper, these are periods where your hands can be soiled, so you need to wash your hands. Then when you've touched the baby anyhow, when you're leaving, you should wash your hands so that you do not carry organisms from one baby to another baby. And then even if you go into the baby's space, around the incubator or around the baby's cot, you can touch, if you touch surfaces there, those surfaces could be contaminated. And so even though you didn't touch the baby, when you're leaving that environment, you need to do a hand wash or a hand rub. So how do you do this hand wash? One of the things that's very clear is that microorganisms on your hand are not just lying there. So they need to be removed properly, and you need to ensure that you remove them from all surfaces. So we have 6 steps that have been identified to make sure that that you cover your the hands in cleaning. So these steps, which we're not counting, you have to wet your hands. You have to apply enough soap to cover all the hand surfaces, and then you rub your hands palm to palm, the right palm over the left palm, then you go over it and you interlace. And it's important to recognize that when you're rubbing, you're actually trying to rub between the, so some people do this. That's not, it's really that you must go in a continuous motion like that. And then you do it the same way again on the other side. And then you want to wash the surfaces, and so you clean. And then you'll notice as we're doing all this, the thumbs are floating, so you clean the thumbs. And when you've done all this, you'll find that the palms of your hand here, it's very easy to miss them, and also the tips of your fingers. So you rub, and when you've done that, you wash your hands, and then you dry it. Now, it's important that you do this for at least 40 seconds, because it takes this rubbing for you to do that. So sometimes we ask you to sing a song like Happy Birthday to you, and you do it 2 times. That usually will take you through 40 to 60 seconds. Now with alcohol hand rub, you have these 6 steps from 2 to 7. You need to put an adequate amount of alcohol in your hand. That is essentially very important. This adequate amount is usually what we'll say a handful, but at least 3 to 5 mils should go into your hands. And then you rub the hands together, and you rub the dorsal, you do the backs of your fingers, you do the thumbs, and you do a rotational rubbing, and then your hands should be dry. Now, if you have enough, if you've put enough hand rub in alcohol in your hands, it should take you at least 20 seconds. And you cannot do anything till the hands are dry. So usually it will take you 20 to 30 seconds for the hands to be dry. If your hands get dry faster than that, you did not use enough alcohol hand rub. So your personal protective equipment, there are quite a number. These are special clothing that you wear on the job to protect against germs that cause infections. And they include the gloves, the goggles, the gowns, and so on. So what do they do? The goggles or the mask protect your eyes. The goggles and eyewear, a shield, protect your eyes and your face. Goggles tend to protect just your eyes, whereas the shield also protects the whole face. The mask protects the mucous membranes of your nose and your mouth, while gloves protect the hands. The gowns protect your clothes. And if you have an apron, it also protects the clothes because you're working frontally with the children. Now the respirators are like masks, but they are more, they are one over your nose and mouth so that you don't breathe in germs. They also protect your nose. And then face shields protect your face, mouth, nose, and eyes. Gloves protect your hands, but there are certain rules about gloves if you want them to be protective. You must change them if they are torn or damaged. You must wash your hands before you wear your gloves, because you can have contamination. You must never wash and reuse disposable gloves. You should not put alcohol hand rub on your gloves. They're meant to be thrown away. What we do know is that when you do this, some of them get damaged. And don't forget, microorganisms are very, very small. And what you cannot see, a little pin prick, 1 million microorganisms can go through a pinhole. You cannot see it. So don't assume that because the glove looks good, that it is not, it has not put you at risk. So please do not rewear. So how do you wear gloves? You're still going to have a practical session, but I'll just quickly take you through this. You take out a glove from its box. These are non-sterile gloves. Most times when we're doing IPC, you do not need sterile gloves, except you're doing an aseptic procedure. So you take out your glove from its original box, and you make sure that you do not touch the surface of the glove. So you hold it at the cuff, and you wear the first one. Then you take the second one, and with your bare hand, and touch only that surface part, and wear the second one to avoid touching the skin of the forearm. You turn the external surface of the glove to be done on the folding hand, thus permitting your glove for the second hand. Once gloved, your hands should not touch anything else that is not defined by your indications. But this will be shown to you properly when you're having your practical session. And then in removing the gloves, there are certain things we want to ensure. At this stage, which is the most critical part, this part is the most critical because this is when you can contaminate yourself. We will assume, once you've worn gloves and used them, it is assumed that they are contaminated. So you do not want your gloved hand to touch your skin. So you'll take the glove, you pinch it, and you remove it. And you hold it. Then you put your finger under the next glove, pull it out so that it covers the glove, and then you throw them out, and then you perform a hand hygiene. Now for masks, most times we use the surgical mask or medical mask, and it became even more relevant now. Everybody's wearing them, and it's usually used for droplet precautions. So you clean your hands before you put your mask on. And when you want to take it off, you make sure that you take it off from the back of your ear. You do not want to touch the surface, because once you're using it, you must assume that the front of your mask is contaminated. When you wear a mask, there is a proper way to wear it. The mask is only useful and effective when it is covering both your mouth and your nose and your mouth. So when you wear it, you make sure it's over your nose, covering it properly, and goes right under your chin. If it is under your nose, it is not working because it's not protecting the air coming in and out. So once you've taken your mask off, if you're not where you can discard it, you can put it in a nylon bag, making sure to not contaminate the outside, and dispose of it once you get where you are. If not, if you have where you can dispose of it immediately. Don't use masks with valves. Those masks are called selfish masks because those valves allow air, droplets from you to go out. It's not protective at all. We also have the plastic aprons, and these are just a waterproof barrier along the front of your body, protecting the skin of the healthcare worker from body fluids. Then goggles and face shield. We use goggles to protect our eyes from chemicals, body fluids, or blood. So when you're cleaning or when you're washing your mops and buckets and so on, please make sure that your eyes are protected. Face shields protect the entire face from splashes as well. So in putting on your PPE, certain rules, you perform your hand hygiene. If you need to wear a gown, you wear it. If you need to wear a mask, you wear it. If you need to use your gloves, you put that on. So if you're wearing all of them, so you perform the hand hygiene, you wear the gown first, you put on your mask, then you put on your gloves. When you're removing, you start from the last one you did that you used. So you remove the gloves, you remove your gown, and the last thing you take off is the mask. And then you clean your hands. Now, your PPE is not the most important thing for protection. It has its limitations. It is only useful if you wear it consistently and correctly. It is more effective when you use it in addition to all the other things that we've talked about: environmental cleaning, making sure that you have safe water. Otherwise, you're not fully protected. The gauze will not protect you from injections. So remember that community health officers have a very important job. You are the first line of defense. You must protect yourself by wearing your PPE and wearing the right PPE for the right job. All PPEs are not needed for every situation. You protect the newborn by performing hand hygiene. You must remember to wear your PPE correctly, to remove your PPE correctly, and to wear the PPE only when needed, and to wear what is needed. So thank you very much. Don't forget, protect your newborn patients. Wash your hands with soap and put on new gloves before attending to each patient. Thank you.